I see with most of my patients post-operatively a significant loss of range of motion, particularly with extension. We find it extremely difficult for a patient to be able to stretch on their own without the use of a device or with access to a physical therapist. We typically see this post-operatively in the total knee arthroplastic patients.
Been skiing since I was 15, professionally, and competing in X Games and do tours like that. I hurt myself last year in March competing for the European X Games. I ended up tearing my ACL and had to stop all my plans for the rest of the year, head back to the United States, and I got surgery. Basically wasn't allowing me to extend my leg for the last 4 degrees. And skiing, that's extremely crucial because you need to be able to be extremely flexible doing the tricks I do.
KneeMD was created in order to help patients independently stretch, in order to help regain full motion and full function of their knee. With KneeMD, the patient has complete control. They're able to set the frequency and the load on the knee. They're able to use it in many different positions, sitting, standing, and even with walking. There are many different aspects of the KneeMD that we use, just like in your regular therapy session when you're working with a physical therapist one-on-one. In addition to stretching and extension, the KneeMD allows a patient to passively move and rotate their leg through the available range of motion. As they passively move, their muscles are completely inhibited and relaxed, which allows them to increase the range of motion with less pain, with less muscle guarding, and less joint stiffness. The KneeMD can be used for active assistive motion, which allows the patient to gain even greater extension when the patient contracts their thigh or their knee, and then the device assists to facilitate more motion. Using the chest strap that comes with the KneeMD, it allows the patient to stay in a relaxed position for a long period of time and allows them to adjust the frequency and the intensity as needed. The straps quickly and easily adjust to accommodate all body types and also all sizes of incisions. The track bar on the KneeMD is a great tool for therapists and patients. It allows the therapist to stay goal-oriented and allows the patient to be self-motivated. The track bar is great for functional goal setting. It allows the patient to be able to see their progress as they're moving along through the activity and the exercise. The KneeMD is highly versatile. It can be used in the clinic, it can be used at home, it can be used at work. It can also be an integral part of an aquatic therapy program.
The KneeMD I use probably 10 minutes a day for 3 times a day, and within that time period, within a month, I was able to completely straighten my leg, and not being able to straighten my leg, I wouldn't be able to really compete.
Of all the devices that are currently available to assist with knee extension, KneeMD is by far the best machine to facilitate extension in the clinic as well as at home, and every patient of mine who's used it would definitely agree.
So this is the KneeMD, and this is how I use it. First off, I usually put it to about 90 degrees for a setting and then slip through pretty easily. I have 3 points of contact, one on the back of my Achilles tendon and then 2 on the front, one below my knee and one above. And just by pulling back, I'm really able to stretch my knee out. And these 2 points of contact keep away any pain because they're surrounding my knee and they're not on top.